Hi, good morning, Arthritis Warriors, and this is Dr. Joff, and today is Movement Monday. Naatay pangutana, we have a question from a nurse. Her name, we call her Estrella, and she's from Cebu, retired nurse. Doc, I am 73 years old, and I want you to know, please, Doc, I want to know, discuss more about the shoulder, any treatment for crepitus in the shoulder. So, thanks so much and more power to your program. So, Ma'am Estrella, salamat sa imong pangutana. The shoulder joint is the joint we have here, no? And crepitations, kanang gitawag crepitus, kanang mutingog ang abaga, that can be normal in many different persons. But if ang crepitations, if ang shoulder movement is painful, if sakit na ang shoulder, I do want you to move your shoulders a lot, loosen up. This is an exercise that you can do every day. Shrug your shoulders up, put it down, roll them around, of course. And of course, you should be able to do this. If your movement in the shoulder is limited, if you cannot lift the shoulder up, if you cannot reach your bra, Ma'am Estrella, then you may have a problem. So, what I want you to do for this Movement Monday is notice if you are able to move your shoulder up without any pain, to the back, kabut sa likod, without any pain, and also if it is painful when you do this, pointing downward, so I'm pointing downward with my thumb, and going up. Still, my thumb is pointing down and my shoulder is going up. If you're able to do the pointing down test and your shoulder is all the way up, then most likely you do not have a shoulder problem. But if you do have any pain in your shoulder, pain sometimes sa gabi, at night, you cannot sleep, and sometimes you have knowing pain, or ngut-ngut sa Bisaya, no? Ngut-ngut, knowing pain that wakes you up. Here are some tips for you. Number one, avoid po yung mga cold, because cold exposure can cause tightness sa shoulder natin and therefore it will worsen your pain. Number two, avoid overhead movement because you know it is painful. The more you do this movement, the more pain you will have. That can be the rubbing of the tendons. And number three, I want you to, of course, avoid yung mga bags, heavy bags, shoulder bags. You don't want to wear that. And lastly, sleeping sa side po. If you sleep sa side, it can worsen the pain. I'm going to share with you a video of the shoulder where you can notice what the possible cause of the pain is. For patients who have very severe pain, who are unable to lift the shoulder, it could be a tear in the rotator cuff muscle, and this can be caused by impingement. The side view of a shoulder, this is an impingement by the bone or the acromion bone. I will share with you the acromion bone that is pointing downward can cause impingement, but the flat bone does not cause impingement. So that is a possible cause of your shoulder pain, Ma'am Estrella. We can get x-rays and we can get MRIs to check this out. So if you didn't understand that, in your shoulder, you have bones in the shoulder. Some of the bones can cause impingement because it is pointing downward. And when you lift your shoulder, maipit ang shoulder by that bone. So this is, again, si Skelly, no? If the acromion here is pointing downward, maipit ang shoulder when he lifts it. So lifting the shoulder when you have a hook-shaped bone may be a possible cause. Of course, tight muscles can also be a possible cause, and another cause is calcium calcific tendinosis. Ibig sabihin po, you may have calcium in the shoulder.